Welcome to Glencoe's Health e-Spotlight video series, where real-world connections help you develop the skills for a healthy future.
People that have a sexually transmitted infection won't necessarily have any symptoms at all.
Gonorrhea sometimes can be asymptomatic, especially in women, or if it's in the throat, or if it's up the bottom. Chlamydia, we know, is asymptomatic in at least 50% of people. Non-specific urethritis can be asymptomatic, HIV can be asymptomatic, syphilis can be asymptomatic, herpes can be asymptomatic, warts can be asymptomatic, pretty much everything.
Herpes is a virus that affects both women and men. The virus can get into the body via a cut or the mucous lining of the genitals. Once it's inside a cell, the virus replicates, destroying the cell's structure, which causes the blisters, tingling and pain. It also travels along nerve fibres to a nerve junction at the base of the spine, where it settles down for life. Over the years, the virus can be reactivated by things like stress or illness, and sometimes it even travels down different nerve fibres, and blisters may turn up somewhere new, like the bum or the thigh. Including herpes, there are up to 25 different infections and infestations you could catch from sex. But unlike herpes, most STIs can be got rid of with a visit to the clinic.
Norman Rockwell captured the awkward innocence of getting a shot. Today, that innocence
Are you ready?
is being injected with just plain awkwardness. Preteen sex talk.
It also prevents against genital warts.
Dr. Shaka Gillen is talking to patients about the HPV vaccine.
Okay. This vaccine is not a license to become sexually active.
It protects girls against the sexually transmitted human papillomavirus, which causes most cases of cervical cancer.
Have you heard about it at all from friends?
It prevents cervical cancer.
Good for you.
It seems like a no-brainer, a series of 3 shots and you're vaccinated. The problem for some parents is the age some doctors recommend their daughters get the vaccine, between 9 and 12.
I actually recommend that she gets it next year.
But she's only 11.
Yeah, that's when I wanted to get it.
Left foot, right foot.
Julia Rogers is 12.
It's beyond her developmental stage. It's like asking her to have a pap smear. You have the polio.
The Rogers aren't opposed to getting vaccinations for their kids.
She's had 21 and he's had 20.
But for now, they're going to pass on this one.
Mommy! I think to have a conversation prior to any even interest in the opposite sex, I think is absolutely beyond their developmental stage, and I think it's inappropriate, to be honest with you.
Is there a part of you that just wants 12 to still be 12?
Absolutely.
And while it's hard for parents to talk about sex while their daughters are still in pigtails,
Go, Julia!
Dr. Gillen says we're talking about cancer and a vaccine for a disease that kills nearly 4,000 women a year in the U.S.
But when you look at how big of a deal cervical cancer is, right?
Yeah.
It's such a big deal that why wait?
She argues it's possible to preserve your daughter's innocence
4.25
and her health at the same time.
So what could a parent say? This is just to keep you safe? Or
Yeah, exactly like they would say for, for at that age a tetanus vaccine or a meningitis vaccine.
Crying and shots have always gone together. But now the only screaming some parents hear
It definitely prevents against genital warts.
is in their heads.
I'm gonna go get you some water.
HIV stands for Human Immunodeficiency Virus, and as the name suggests, it attacks your immune system, which is the body's crucial self-defense against disease. Without effective drug treatment, HIV-positive patients become vulnerable to a variety of bacterial, fungal and viral infections that an intact immune system will easily cope with. The virus lives in bodily fluids, including the sexual fluids and blood. So, the 2 main routes of infection are unprotected sex and sharing dirty needles. In the first 2 to 3 weeks after initial infection, symptoms may show up which can easily be mistaken for flu. So, if you think you put yourself at risk, go for a blood test as the symptoms are either non-existent or at best vague. only a blood test will clarify whether or not you have HIV.
When a patient is considering therapy, we give them all the information. The drugs are toxic, they're difficult. Some of the drugs you have to take on an empty tummy, some you have to take with food, some you have to take with 2 extra litres of water. And some patients end up setting their alarm clock at 6 o'clock in the morning.
I suppose in a way I have got, my doubts, whether, is these going to work, or will I have to go on to something else, or, what if that fails? And you're like a guinea pig, really, because, you're always trying different things, but what has to be, has to be.
Adherence is crucial. You need to take almost 100% of your drugs. Going away for a weekend and missing a couple of doses can be a major problem, because that takes the pressure off the virus, it grows again, and now you might have resistant virus when you start your drugs again on Monday.
A healthy body generates something called T cells, or killer cells. It's their job to attack viruses. But what scientists like Bruce Walker didn't know until now is why those killer cells stopped working in most HIV patients.
One hypothesis has been that they become inactivated. One hypothesis is that they become destroyed. And what this study shows is actually that the cells are there, they're fully functional, it's just that they have been turned off.
Turned off by HIV. The virus disarms T cells by flicking off a molecular switch in the cells. In the laboratory, researchers were able to block that switch and restore T cell function. The findings raise the possibility that one day doctors could switch a chronically ill patient's immune system back on so that it could resume its fight against HIV, cancer, or even hepatitis C. But there's one big concern. By manipulating the immune system, you could send it into overdrive, triggering autoimmune disease, attacking healthy parts of the body.
We really don't know what's going to happen when we try and do this in humans. It opens a new pathway for us to pursue, but we really will need to proceed with caution.
You've been watching Glencoe's Healthy Spotlight video series. Remember, be healthy, choose wisely.